As a urologist and andrologist with 15 years of experience, I have observed a significant transformation in how we approach sexuality in old age. In my office, I often receive patients over 60 who, initially hesitant, begin to open up about their doubts, desires, and discoveries related to their sexual life. This change in perspective has been not only gratifying, but also fundamental in promoting healthier and more fulfilling aging. Susan, a 68-year-old lady, arrived at my office on an autumn afternoon. With a shy look and restless hands on her lap, she began to share her story. Widowed for 5 years, she felt guilty for still having desires and wants. "Doctor, is it normal to feel this way at my age?" she asked in a low voice. This question, so simple yet so profound, summarizes the dilemma of many elderly people in our society. The truth is that sexuality has no expiration date. It is a fundamental part of our identity that accompanies us throughout life, although it manifests itself differently in each phase. What many don't understand is that aging, far from being a period of sexual decline, can be a phase of rediscoveries and new experiences. During my international specialization in sexual medicine, I came into contact with revolutionary research demonstrating how self-care and the expression of sexuality in old age are directly linked to better indicators of physical and mental health. Studies conducted at renowned research centers show that sexually active elderly people have a lower incidence of depression, better cognitive function, and a strengthened immune system. The case of Robert, a 73-year-old retired professor, perfectly illustrates these benefits. After participating in a support group on health in old age, he began to allow himself to explore his sexuality without guilt or shame. "It was like rediscovering a part of me that was dormant," he shared in one of our consultations. In a few months, his blood pressure stabilized, his sleep improved significantly, and his disposition for daily activities increased considerably. It is essential to demystify the idea that sexual pleasure in old age is inappropriate or less important. In fact, it is precisely at this stage of life that many people have the opportunity to explore their sexuality with more maturity and self-knowledge. Free from the social and professional pressures that characterize youth, the elderly can develop a healthier and more conscious relationship with their bodies and desires. Self-care, including the practice of masturbation, plays a crucial role in this process. During my residency at a reference hospital, I participated in studies that proved how this practice contributes to the maintenance of urological and gynecological health. Regular masturbation helps maintain the vascularization of the genital organs, prevents atrophy, and contributes to strengthening the pelvic floor, fundamental aspects for quality of life in old age. Nancy, a 65-year-old visual artist, discovered the benefits of self-care after participating in workshops on sexual health. "At first, I felt ashamed even to think about the subject," she confessed. "But when I began to understand that taking care of my sexuality was as important as exercising or maintaining a healthy diet, everything changed." Today, Nancy not only practices self-care regularly, but also encourages other women her age to break taboos on the subject. As a healthcare professional, I have observed that when we approach sexuality in old age in a natural and respectful way, we open doors to important conversations about general health. Many of my patients, feeling comfortable talking about their sexual experiences, also begin to discuss other aspects of their health that they previously neglected. Society is gradually changing its perception of aging and sexuality. In my lectures and support groups, I have noticed a growing interest from health professionals and the general public in better understanding this topic. It is gratifying to see how information based on scientific evidence can help deconstruct prejudices and promote a more positive and healthy view of sexuality in old age. In my journey as a specialist doctor in male and female health, I have documented numerous cases that demonstrate how self-care and healthy expression of sexuality can transform the quality of life of the elderly. The benefits go far beyond momentary pleasure, extending to fundamental aspects of physical and emotional health. During my international specialization, I had access to longitudinal studies that followed elderly people for more than a decade. The results were surprising. Those who maintained an active sex life, including the regular practice of masturbation, had significantly lower levels of cortisol, the stress hormone. This discovery has profound implications for the treatment of common conditions in old age, such as anxiety and sleep disorders. In the case of Samuel, a 70-year-old retired businessman, perfectly illustrates these benefits. When he started visiting my office, he suffered from chronic insomnia and had high levels of anxiety. After a few consultations, I developed a self-care plan with him that included breathing exercises, stretching, and self-stimulation practices. At first, I thought it was strange for a doctor to talk so openly about these matters, he confessed. But after I started following the guidelines, my sleep improved drastically, and I feel much more willing. From a physiological point of view, the regular practice of sexual self-care promotes the release of endorphins and oxytocin, natural hormones that act as analgesics and provide a sense of well-being. In my research during medical residency, I observed how these hormones contribute to the reduction of chronic pain and improve joint mobility. Frequent complaints among the elderly. Helen, a 67-year-old retired teacher, is a notable example. She came to my office with complaints of joint pain and muscle stiffness. After including self-care practices in her routine, she noticed a significant improvement in her flexibility and physical disposition. I never imagined that taking care of my sexuality could have such an impact on my overall health, she shared in one of our follow-up consultations. Blood circulation is another aspect that deserves attention. Sexual self-care promotes better vascularization of tissues, contributing to the prevention of cardiovascular problems and improving cellular oxygenation. During my work at a reference hospital, I participated in studies that demonstrated how the regular practice of masturbation can help maintain the elasticity of blood vessels and prevent atrophy of genital tissues. The psychological impact is also notable. Many of my patients report a significant improvement in self-esteem and perception of their own image after beginning to practice sexual self-care consciously. Carmen, a 71-year-old lady, shared how this change affected her life. After I learned to know myself better and accept my body as it is, I started to feel more confident in all aspects of my life. In my lectures on health in old age, I always emphasize how sexual self-care can be a powerful tool to combat depression and social isolation, common problems in this phase of life. Regular practice helps maintain balanced serotonin levels, contributing to a more positive mood and a greater willingness for social interactions. The case of George, a 69-year-old retired engineer, is particularly touching. After becoming a widower, he developed symptoms of depression and isolated himself socially. During our follow-up, we worked not only on physical aspects of self-care, but also on the importance of maintaining a healthy connection with his own body and emotions. I learned that taking care of myself is not selfishness, it's a necessity, he reported after a few months of treatment. As a healthcare professional, I have observed that when the elderly understand and accept their sexuality as a natural part of their lives, they tend to engage more actively in other aspects of self-care. They start exercising more, eating better, and maintaining regular medical checkups. It's as if reconnecting with their sexuality opens doors to more comprehensive health care. In my clinical practice, I frequently encounter situations that reveal how social stigmas can profoundly affect the health and well-being of the elderly. As a specialist in urology and andrology, I have dedicated a significant part of my work to deconstructing myths and prejudices surrounding sexuality in old age. I particularly remember the case of Teresa, a 72-year-old lady who came to my office extremely distressed. She had been criticized by her own daughter for mentioning that she was interested in participating in a discussion group about sexuality for the elderly. "Doctor, is it wrong for me to want to learn more about my body at this age?" she asked, with tears in her eyes. This situation perfectly illustrates how prejudices can come even from close people. During my international specialization, I came into contact with different cultures and their approaches to sexuality and aging. In some countries, such as Japan and Nordic countries, there is a more natural and respectful view of the subject. These experiences helped me develop strategies to address the issue more effectively with my American patients. Prejudice does not only affect women, Charles, a 75-year-old retired lawyer, shared how he felt embarrassed when buying products for his intimate health at the pharmacy. "People looked at me as if it was wrong, as if at my age I shouldn't worry about this," he reported. Situations like this demonstrate how social judgment can create significant barriers to self-care. In my lectures and support groups, I always emphasize that sexuality is a natural and important dimension of human life, regardless of age. I base myself on scientific studies conducted at important research centers that prove how the repression of sexuality can lead to physical and mental health problems. One of the strategies I've developed over the years is to encourage my patients to form mutual support groups. Mrs. Cecilia, 69, was one of the pioneers in this initiative. After overcoming her own prejudices, she began organizing meetings with other women her age to discuss health and well-being. When we share our experiences, we realize that we are not alone and that our feelings are valid, she explains. During my residency at a reference hospital, I participated in research that demonstrated how adequate social support can make a significant difference in the health of the elderly. Patients who had a supportive network showed better results in various aspects of health, including cardiovascular function and the immune system. The case of August, a 78-year-old university professor, is particularly inspiring. After years of struggling against his own prejudices, he decided to seek professional help for issues related to his sexuality. "I realized I was depriving myself of an important part of life because of what others might think," he shared. Today, August actively participates in discussion groups about men's health and helps other men overcome their fears and prejudices. As a health professional, I have observed a gradual change in society. Increasingly, I find family members supporting their loved ones in the pursuit of a healthy sex life in old age. Martha, 66, tells how her granddaughter helped her overcome the embarrassment of seeking medical care for intimate issues. "She told me I had the right to be happy and take care of myself in all aspects." The continuing education of health professionals also plays a fundamental role in this change. In my classes and workshops for other doctors and professionals in the field, I always emphasize the importance of addressing the sexuality of the elderly with naturalness and respect. The impact of this approach is reflected in the growing number of patients who feel comfortable discussing their doubts and concerns. The media also has an important role in deconstructing stigmas. I have participated in programs and interviews where we can openly discuss sexuality in old age, always based on scientific evidence and real cases. This exposure helps normalize the topic and encourages more people to seek help when needed. As a specialist in sexual medicine, I have the privilege of following extraordinary stories of rediscoveries and transformations. The process of reconnecting with one's own sexuality in old age can be a deeply enriching journey, full of learnings and positive surprises. Mrs. Betty, a 70-year-old artist, came to my office questioning whether it was still possible to feel pleasure at her age. After years dedicated to family and work, she had forgotten about her own sensuality. During our follow-up, we developed a personalized program of self-knowledge and intimate care. "It's like I'm discovering a new world," she shared after a few months. "I never imagined I could feel so alive and connected to myself." In my international experience, I came into contact with innovative approaches to promoting sexual well-being in old age. Mindfulness techniques and body awareness, when adapted for this audience, show surprising results. During my residency, I participated in studies that proved how these practices can help recover sensitivity and improve sexual response. The case of Mr. John, a 73-year-old retired businessman, illustrates this process well. After a health problem, he needed to relearn how to connect with his body. Through specific exercises and self-care practices, he managed to recover not only his sexual function, but also his self-esteem. "I learned that pleasure is not limited to a single aspect of sexuality," he reported. "There are many ways to feel and express intimacy." Intimacy in old age often takes on more subtle and profound forms. In my lectures, I always emphasize how touch, affection, and emotional connection are fundamental for a satisfying sex life. Mrs. Margaret, 68, discovered this after participating in workshops on conscious sensuality. I realized that true intimacy begins with self-love, she shared. During my specialization, I learned that the rediscovery of pleasure in old age is closely linked to accepting the natural changes of the body. Aurora, a 71-year-old retired teacher, found in dance a way to reconnect with her sensuality. When I started moving without judgments, my relationship with my body changed completely, she says. The role of technology in this process also deserves highlight. In my clinical practice, I have observed how meditation apps and specific exercises can assist in the process of self-knowledge. Mr. Anthony, 76, overcame his initial resistance to technology, and today uses various digital resources to maintain his intimate health. Technology has helped me maintain a self-care routine, he explains. The importance of open dialogue about desires and needs is another fundamental aspect that I address in my consultations. Mrs. Claire, 69, learned to communicate her wishes after years of silence. When I started talking openly about my desires, I realized there was no reason for shame, she reports. In my support groups, I encourage the exchange of experiences among participants, always respecting everyone's privacy. It's exciting to see how people who initially felt isolated in their issues discover that they are not alone. Mr. Paul, 77, found comfort and inspiration in these exchanges. Hearing other stories made me realize that it's never too late to start over. As a doctor, I have observed that the rediscovery of pleasure in old age often leads to an overall improvement in quality of life. Mrs. Judith, 74, noticed significant changes in her mood and disposition after starting to practice self-care regularly. It's as if a new energy has awakened in me, she describes. The regular practice of specific exercises for the pelvic floor, combined with breathing and relaxation techniques, has proven to be extremely effective. During my residency, I developed personalized protocols that adapt these practices to the individual needs of each patient, respecting their limitations and potentials. In 15 years of experience as a specialist in urology and andrology, I have witnessed how self-care can be a powerful tool for transformation in the lives of the elderly. This change goes far beyond physical aspects, reaching emotional and social dimensions that significantly impact quality of life. The case of Mrs. Christina, a retired seamstress of 67 years, is a notable example of this transformation. When I met her, she suffered from chronic anxiety problems and low self-esteem. Through a personalized self-care program, which included specific exercises and self-knowledge practices, she gradually regained her confidence. I started looking at myself in the mirror differently, she says. I realized that my body, even with its marks of time, deserves love and care. During my international specialization, I had access to innovative research demonstrating how regular sexual self-care can positively influence various aspects of health. Studies conducted at renowned research centers point to a significant correlation between the practice of self-care and the reduction of problems such as hypertension, anxiety, and sleep disorders. Mr. Gerald, a retired accountant of 73 years, discovered the benefits of self-care after participating in one of the support groups I coordinate. At first, I thought these practices weren't for my age, he confesses. But when I started incorporating self-care into my routine, I noticed a significant improvement in my disposition and even in my ability to concentrate. In my clinical practice, I developed an integral approach that combines different aspects of self-care. I work with specific exercises for the pelvic floor, conscious breathing techniques, and relaxation practices. Mrs. April, 70 years old, found in this combination a new way to relate to her body. I learned that every small gesture of care has an important impact on my well-being, she reports. Transformation often begins with small steps. During my residency at a reference hospital, I observed how simple changes in routine can lead to surprising results. Mr. Vincent, 75 years old, started by dedicating just 5 minutes daily to breathing exercises and self-care. Gradually, these practices became a natural part of his life, bringing benefits he never imagined possible. The impact of self-care on self-esteem is particularly notable. Mrs. Laura, a retired teacher of 69 years, reports how her relationship with the mirror changed completely after she began practicing regular self-care. Before, I avoided looking at myself. Today, I see a strong and confident woman who deserves to take care of herself and be happy, she shares with a smile on her face. In my lectures on health and old age, I always emphasize how self-care can be an empowerment tool. Mr. Albert, 78 years old, became a true ambassador of this message after his own journey of discoveries. I realized that taking care of myself is not selfishness. It's a fundamental necessity to live well, he explains to other group participants. The regular practice of self-care also has a significant impact on social relationships. Mrs. Marlene, 71 years old, noticed how her social life flourished after she started taking better care of herself. When I started valuing myself, people around me also began to see me differently, she observes. Today, I have more friendships and feel more confident in social situations. During my specialization, I learned that self-care in old age needs to be adapted to individual needs and limitations. I work with each patient to develop a personalized program that respects their pace and preferences. Mr. Joaquin, 76 years old, found his own path in self-care. The doctor helped me understand that there is no single formula. The important thing is to discover what works for me. As a health professional, I have observed that regular self-care can be a determining factor in preventing various common health problems in old age. Based on scientific evidence and my clinical experience, I can affirm that investing time and attention in self-care is one of the best investments a person can make in their health and well-being. As a specialist in male and female health, I have the privilege of witnessing a true revolution in how we face aging. Through the stories of my patients and the most recent scientific discoveries, I can state with conviction that we are living in a moment of profound transformation in understanding what it means to age with quality of life. Mrs. Regina, a 72-year-old writer, summarizes this paradigm shift well. When I was young, I imagined that reaching 70 would mean giving up many things, especially pleasure and sensuality, she says. Today, I realize that this phase of life can be as rich and satisfying as any other, as long as we know how to take care of ourselves and respect ourselves. During my international specialization, I came into contact with innovative approaches that integrate different aspects of well-being in old age. I discovered that countries that value the wisdom and experience of the elderly tend to have higher rates of satisfaction and quality of life in this age group. Mr. Ernest, 77 years old, found inspiration in these different cultural perspectives. I learned that aging can be a much more positive experience than our society usually shows. In my clinical practice, I develop work that goes beyond treating specific symptoms. I seek to help my patients build a new narrative about their aging process. Mrs. Celia, a 68-year-old visual artist, discovered through our consultations that she could be the protagonist of her own story. I realized that I didn't need to passively accept the limitations imposed on me. The impact of changes in behavior and attitude is surprising. During my residency at a reference hospital, I participated in studies that demonstrated how a positive approach to aging can influence various biological markers. Mr. Anthony, 75 years old, is a living example of these benefits. When I started to see and treat myself with more affection, even my routine exams improved. The integration between physical and emotional health is fundamental in this process. In my lectures, I always emphasize how self-care and healthy expression of sexuality contribute to more balanced aging. Mrs. Francis, 70 years old, found in this integral approach a new meaning for her life. I learned that taking care of the body is also taking care of the soul. The role of family in this transformation cannot be underestimated. I have observed how family support can make a significant difference in how the elderly experience this phase of life. Mary Jane, 73 years old, tells how the encouragement of her children was fundamental. When I saw that my family supported me in my discoveries and decisions, I felt more secure to explore new paths. Technology has proven to be an important ally in this process. In my practice, I use digital resources to assist my patients in their self-care process. Mr. Charles, 76 years old, overcame his initial fear and today uses apps and devices that help him maintain a healthy routine. Technology helped me feel more connected and up to date. The concept of pleasure in old age is also undergoing an important revision. Through support groups and open discussions, we have been able to break taboos and build a healthier understanding of sexuality at this stage of life. Mrs. Teresa, 69 years old, summarizes this change well. I discovered that pleasure has no age, it just transforms and matures with us. As a health professional, I feel optimistic about the changes I have observed. Increasingly, I find elderly people willing to question stereotypes and seek a fuller and more satisfying life. Mr. Paul, 74 years old, has become a true example of this new perspective. I learned that each phase of life has its own discoveries and joys. Through my professional experience and the inspiring stories of my patients, I can affirm that aging can be a period of profound personal growth and discoveries. When we approach this phase with knowledge, respect, and care, we open space for truly transformative experiences.